If you look at the picture on the left, this is before we did any work on Karen, any cosmetic work at all. And you can see her upper teeth are very short and worn down. She has a reverse smile line. Her smile is frown shaped, if you will. So the first thing we did was porcelain crowns on her front 6 teeth to give her whiter and nicer looking teeth that are the proper size. And what we need to do today is continue the process by putting veneers on the lower teeth and 1 tooth on each side of the bridge, so that when she smiles, she has white teeth on the upper and lower to really finish out a complete cosmetic enhancement for her smile. Putting a little topical anesthesia there now. We're going to numb her up for this procedure. Give her a little lidocaine, 2%. Now we're going to prepare the teeth for veneers. Now with veneers, you don't have to remove as much of the tooth as for other types of dentistry, like crowns and bridges. But we do have to prepare the teeth. Usually just the surface of the tooth, the enamel, when we do veneers. So we're doing her lower 6 front teeth, preparing those now. Prepare them a little bit on the inside. I like to have the veneer cover the outside of the tooth and lap just a little bit onto the inside for better support and appearance. We're going to be doing also 2 veneers on the upper teeth, so that when she smiles, we're going to be doing 1 premolar on each side adjacent to the bridge. We're going to be taking an impression there. After the impressions are taken, we send the impressions to the lab. This is my laboratory technician, Taz, and he's going to be making the veneers. Now, with Karen here, we're making composite veneers and not porcelain veneers. The benefit to doing the composite veneers are that she can have the veneers in one night. Although they don't have as much beauty as the porcelain veneers, they're a nice alternative for the patient. Here's my technician forming the veneers out of a very hard white composite material called Conquest. Now what we're going to do is try the veneers on. Now the process for the composite veneers and for porcelain veneers is identical. Although again, with the porcelain veneers, usually a week or 2 needs to be waited for the lab to process the porcelain. Here we did this in the same night, which is a nice benefit for the patient. But the process is the same. First we etch the teeth with that blue gel, and we put the primer on, which I also like Cure, as well as the bonding agent. Then when I cement the veneers on, what I like to do is I like to place all of the veneers on at the same time. And you'll notice that the video is a little darker now. I shut the overhead light on, I just have the operatory light, my dental light on, so that the ambient light in the room doesn't start setting up the veneer. So now I light cure the veneers onto the teeth. After the veneers are cemented on, we have to trim the excess cement and also shape the veneers a little bit better. Doing the upper ones also. Now we check the bite. I have her bite on what's called articulating paper to make sure that when she bites it's even and comfortable. If she bites down too hard on the veneer, she can damage the veneer and also cause soreness in the teeth and gums. So you need to make sure that she's not contacting the veneers too firmly when she bites down. Just making sure the bite's okay. My assistant suctioning there. Still adjusting the veneers where you see those blue spots. That's where she was hitting too hard. Trimming the veneers. shaping them a little bit, making them look more natural, more like natural teeth. The spaces that you would normally see in between natural teeth. Smoothing them now with a sandpaper disc, polishing them, smoothing out all the rough edges. Shining them up as well. I was very pleased with the shade match between the porcelain and the composite veneers or the conquest veneers. The result I thought was quite good. And the color match was, as you can see, was pretty close. She was happy with the color. We were happy with that. It looks much, much nicer there now. Much more uniform. You look great. Beautiful.
Thank you very much.
You're welcome.
You did a good job. You really did.
Look nice.
He did a nice job. If you saw them before, I think he did an excellent job.